Okay, so we'll start with the webinar now. So good afternoon to one and all, and great apologies today for all the background music that's there. I got stuck somewhere, so I am sitting in the staircase and doing the webinar. Very sorry for that. So it gives me great pleasure to have one more webinar hosted by Dr. Tariq Jagmag. I know Dr. Tariq from the past 18, 19 years. He's been my great friend, and now he's also my mentor, teacher. He's also a family physician, and he has healed great many people. And this is our mission, that with his knowledge, we want to reach as many people as we can. You must have heard that saying that little drops of water and small bits of sand make the beauteous land and the mightiest ocean. So here we are with our little drops of water and little drops of sand, trying to make a difference in as many lives as we can. Our last webinar was actually very good. We got many people calling us for help, reaching out to us. So that's another reason that we are continuing. So some things about Dr. Tariq. I'll tell you in short because there's a big list of his accomplishments. So he has two patents. One of them is Imusil, which he will be touching upon today. It's a herbal combination which is used for weight loss. It's also used for long COVID and COVID, which we already covered last time. He is a genius person. You will come to know in the webinar when you hear him. He is a specialist in psychoneuroendocrinoimmunology and scientific-based homeopathy. He has many publications in scientific international journals which are peer-reviewed. So this is a big thing. So without further delay, let's begin this webinar and let's get our bodies into shapes. Well, round is also a shape, but we can make it better shape. Yes, over to you, Dr. Tariq.
Yeah, so hi all of you. I think what we can do is when we are starting this, we can give the dais to Dr. Baljit, and he could talk about a few of the effects that he's felt after what I've been teaching. So Dr. Baljit, are you there, please?
Hi, Dr. Tariq, I'm here.
Hi,
can you hear me? Am I audible?
Yes, I can hear you. So
okay,
you'd like to talk about your own case and your own journey?
I try and just cover it with as little time as possible. I'm now 58 years old, and at the age of 42, I was very insulin resistant. I reached a weight of 92 kgs. And that was my journey into integrative medicine because I had to fix myself first. I was diabetic, I had very high cholesterol, and I was hypertensive. And I started on a ketogenic diet, and within 30 days, I lost a lot of weight, and the diabetes disappeared, the insulin dropped, pressure returned to normal, and I was very happy about that. I went from 92 to 78 kilograms at the age of 44 in about 30 days, which I was very happy about. And I try to maintain the ketogenic diet for as long as possible, but it is extremely tedious to live in an Asian country and not eat carbohydrates at all. Over the years, I unfortunately regained most of my weight. And about the middle of last year, I reached 92 kgs again. By this time, I became a student of Dr. Tariq's online. Mind you, some years ago, we had a conference here. Mafim had a conference and invited some really good people. One of them was, what's his name?
Which country?
Italian American, the researcher on longevity. What's his name? He's got a very good book.
I also forgot.
Yeah, let me Google him. Anyway, I was fortunate enough to have 5 minutes to talk with him. His name is Walter Longo, sorry.
Yeah, Longo.
Walter Longo. So I had 5 minutes to chat with him, and I said, Dr. Longo, you know, I was on the ketogenic diet, and he said, hey, you don't go on the ketogenic diet for too long. All the animals they have experimented with the ketogenic diet over a long period of time, they all died. So he said, ketogenic diet is really good for a short while, 3 months, 6 months, but after that, please, you cannot keep doing the ketogenic diet. So I kept trying the ketogenic diet, but it didn't work anymore. I finally went down to 1 meal a day, you know, just an evening meal with as little carbohydrates as possible, no breakfast, no lunch, black tea, black coffee. Monday to Friday, I would do that. I would lose a little bit of weight over the weekend. My wife and I will have 1 or 2 carb meals, go out and have some bread somewhere or some rice somewhere. By Monday, my weight will come back to where it was. So it was like this movie Groundhog Day, every day is the same. Have you watched Groundhog Day? So mine was a Groundhog week in terms of weight. I'll be 90 kgs on Monday. I will lose down to 88 or 88 and 87.5 by Friday. By Monday, I'll be back to 88, 89 kgs. Just over 2-3 carbohydrate meals over the weekend. So that's when I started really paying attention in class. And then when the Immusil was available, I started that. But that gave some effect. But when I started on the Akkermansia and the leptin resistance, my weight started to really come down, even though I started eating some carbs. Now I'm actually able to have a bit of a lunch and maintain my dinner. And also over the weekends, if I indulge in a little bit of carbohydrate, my weight on Monday is not what it was the week. It is actually slowly coming down. So from 92 kg.
Your waist size is also decreasing, right? The fat on your abdomen.
Yeah, absolutely. The waist size is spectacular because I think I'm also gaining some muscle. So the weight is one thing, but the waist size, I'm now able to fit into a trousers that I've not been able to wear in the past 4 to 5 years. Yeah. I got about 8 pairs of trousers and only 2 that fit. Over the years, the weight, and so I'm really happy that I could get back into my previous, these trousers. So the waist size coming down, that is really noticeable.
Good, dog. I think your insulin is also improved now. Your fasting insulin is also gone down, right?
I've not measured the insulin yet, but the sugar my morning sugar, probably because of dawn phenomena, would be about 8. Those days it'll be about 8. And it will take a really long time to come down. But then when I have dinner again, the thing shoots up. Yeah. Now I can get sugars less than 5, 4.8. 5. So, and mind you, this is with an additional meal. Previously, it was 8 with 1 meal a day, no carbs. Any slight let go of the carbs and that's it. The sugar spikes and the weight just keeps coming back.
So now you can eat like a proper meal and yet have your glucose at a normal level.
Yes.
That's awesome.
So thanks, I just wanted to share this
journey.
Thank you.
Thanks a lot. So let's start this series on waist loss and weight loss. I'm going to try to do my best to explain to you guys what are the factors that cause you to gain weight. And I want to try to explain what are the symptoms you should see in your body to understand which of those factors is leading to your weight loss. So for example, in Dr. Baljit's case, it's been the high insulin resistance. He was resistant to insulin. So as you become more and more resistant to insulin, you become more and more diabetic. Even if your blood sugar is stable and you see that your morning fasting glucose and your HbA1c is normal, you may still be pre-diabetic and you may still have insulin resistance. So what I'm going to teach you today is how to look at your own signs and symptoms and understand which of these things is causing you problems. So let's look at the share screen. I'm going to go to share screen and try to draw these pathways out for you. So in weight, I'm going to divide this into mainly 4 categories. The first focus is going to be on your gut. So the possible gut disorders which can lead to weight gain, and how to identify which one you're suffering from. The next thing is hormones which are involved, which can cause you weight gain. One of which you guys already know is thyroid. Another hormone is cortisol. Third one is your insulin resistance. I'm putting it as a second category, as a separate category, even though insulin is a hormone and it should ideally come under hormones, because this is a very important factor as you grow older. And here comes the role of inflammation, where we were talking about Immusil's role. And the last bit is stress. So these are the broad 4 categories that cause you weight gain and which cause you that resistant weight which doesn't go. Mainly that weight sticks to your abdomen, sticks to your arms and makes your arms really jiggly and makes your abdomen enlarged. Okay. Most people, this is a very interesting thing. A whole bunch of actors were asked, What is the first thing you do in the morning when you wake up? And most of them said that, well, we wake up in the morning, we go to poo, and the moment we come back from pooing, we lift up our shirt and we look at our stomach. And it's a very interesting thing. We think that the first thing a person does is look at their mobile phones in this day and age. But surprisingly, the first thing that people do in the morning when they wake up after coming out from the bathroom is look at their stomach size. And it's such an important factor to want to see a stomach that is not jiggly. So let's go and look at the features or the factors in your body which are causing you these problems. Let's look at gut disorders. Now we all know what a gut is, right? It's our intestine, our stomach, our digestion. So one very interesting thing that was seen in kids who are obese is actually these kids who are obese have a lot of malnutrition. They're actually malnourished children. They are so malnourished that the levels of vitamins, B complex, vitamin D is completely and abysmally low. They are very low in minerals. And it is that malnourishment that makes them keep eating, eating, eating. What is it that makes you so malnourished even though you're eating so much of food? First thing, of course, is you may be eating the wrong type of food. If you eat a McDonald's burger every day, that has absolutely no nutritional content in it except fat and calories. So you don't get the amount of B complex, you don't get the amount of nutrients. That part leave aside because most people here in this course would have already taken health advice from a nutritionist and would be on a very healthy diet. So what are the factors? The first thing that happens is infections. What are these infections in your gut which cause you to eat so much and yet be malnourished? The first guy is parasites. Now you imagine parasites to be these they look like these long worms or like round worms or ascaris, but it's not always these worms. You actually have these tiny little microscopic intracellular parasites which cause you to have malabsorption. What we do is we give a 8-day protocol of antiparasitic drugs. These are all allopathic drugs in sequence one after the other. And using this sequence, we are able to rid the body of parasites. Many of my patients after a single course of 8 days have lost around 2 to 3 kgs of weight. And that is not fat, that is just parasites coming out from their body. We usually repeat this course after 1 month again, and we repeat it again after 8 months. If you want to know more about the antiparasitic course, you can just contact Dr. Shamal or you can contact Amanda, who can help you understand what the course is and how to do it. This is not a course that I have invented. It is already there in the field of medicine. Usually what is done in medical practice is patients are just given one albendazole or one tablet of mebendazole. But that only targets a few species of parasites. You need to target the entire bunch of them, including the intracellular ones, which is why you need this 8-day course. The next thing is fungus. Oh, before I finish, how do you know that you have parasitic infections? If you have an anal itch, after eating some sweet food or after eating some meat especially, you eat chicken or you eat mutton and you start having anal itching. Or you eat chicken and mutton and the next day while passing motions, you feel there is burning in your anus after eating chicken or mutton. Or you start having a lot of gas in the night after eating chicken or mutton. Remember that that's a sign that you have parasites. You could start having itching on your skin because of parasites. In your blood test, you may have an elevation of eosinophils because you have a parasitic infection. So these are the signs and symptoms that you have parasites in your body. Next one, fungus. Fungus is basically things like candida. How do you know you have candida? Well, you could have skin lesions on your skin, on your hands, on your stomach. These are little ringworm-like infections. You could have dandruff on your hair, constant itching of your scalp. That's a sign that you have candida. If you're a female patient, you may have vaginal itching that happens, especially after being wetted. So after having a bath, you may start finding that there is vaginal itching. You could have itching below your breast. You could have itching in your skin folds. These are all signs that you have itching. But the most important sign that you have fungal infection is basically constipation. So when there's a fungal infection or a candida overgrowth in your end colon or in your distal colon, The body's macrophages in that area, which are a type of white blood cells, are actually supposed to throw out water. They don't want the fungal toxins to be absorbed inside your body, so they start throwing water out. So ideally, your stool should become loose and you should get diarrhea. This is what we see in children in India. Whenever they get a fungal infection, they usually end up getting diarrhea. It's a good sign. But as you grow older, what tends to happen is those macrophages don't function very well. So instead of throwing water out, they start absorbing water in. And as they start absorbing this fungal toxin inside your body, you start getting constipated. When the fungal toxin enters inside your body, it starts causing you insomnia, it starts causing you weight gain, lower back pain, sleep disturbances happen. And your patients will usually tell me, doctor, if I eat a sugar containing meal in the night, if I eat a carbohydrate in the night, if I eat some ice cream or cake in the night, then I just don't get sleep in the night. The lack of sleep after the carbohydrate could very well be insulin and diabetes, but it's most likely a fungal infection, especially when you're a young person. If you develop itching on your skin after eating a carbohydrate in the night, again, that is a sign that you have a fungal infection. How do we treat these fungal infections? Allopathically, we give drugs like itraconazole, ketoconazole, fluconazole. But what we are doing is we are using low-dose homeopathics. One of them is a homeopathic called as phytolacca. This is given maybe like in a 30C potency, and it's very good at ridding your body of fungal infections. Another homeopathic is lycopodium. Dr. Sharma knows this very well because she gives it to all her patients who have dental pockets. In patients who have fungal infections, whom the fungal infection due to stress disorders, the patient will have frequent bloating, frequent burping. In such cases, lycopodium is useful. Phytolacca is useful when you have a fungal infection with hyperpigmentation. So that's one other feature. Skin starts to become tan very easily when you have a fungal infection. So if your patient tells you, when I go out in the sun, my skin starts getting tan very easily, that's most likely a fungal infection in your body. You need to take this phytolacca 30C, maybe like 4 drops of it, maybe once a day. Same with lycopodium, maybe 30C, 4 drops once a day. And what we also do is we give them a combo of ours called the antifungal combo. This has herbal antifungal remedies inside, which helps to treat fungal infections out. We've treated even patients with severe rheumatoid arthritis and osteoarthritis using these simple remedies, because you could have fungal mediated arthritis as well. So again, let's repeat the symptoms that you may think of. One is constipation. The colon is dry. Okay? When you eat a carbohydrate meal in the night, you don't get sleep in the night. You start having anal itching again. Another simple, which is one other symptom of a parasitic infection. But in parasitic infections, it's mainly anal itching after eating meat or chicken or some protein. You could have dandruff in your hair. You can have vaginal itching. These are all symptoms that you have a fungal infection. Skin darkening, which is very easy, again is a sign that you have a fungal infection. Can you please mute yourselves if I hear a lot of background noise? I'm going to have to mute everybody. Can you mute people? I'm trying to mute people. Okay.
Dr. Tariq.
Dr. Kaur, yeah, you're on.
You're speaking very softly. I can't really hear you.
Okay. My voice is usually quite clear. Is there anybody else having problems in hearing my voice?
No, Dr. Tariq, it's clear for us.
It's clear now. Okay.
For me, it's not clear. I'm surprised. Normally, it's very clear.
Please adjust your microphone, Dr. Kaur, yeah?
I'm sitting right next to it.
Okay.
Thank you. Thank you.
Okay, doctor. Everybody else is muted? All right, let's continue. Okay, so that's a fungal infection and parasite. What other infections could you have which are causing you weight gain? The third infection that could be happening is SIBO, which is called a small intestinal bowel overgrowth. So these are bacteria which are growing in your small intestine and they grow in number. And as they grow in number, the symptoms are you get a lot of bloating and gas constantly. You have to frequently run to the toilet to pass motions. SIBO also leads to fatty liver, can also lead to diabetes. A lot of patients who are diabetic have SIBO. Almost 80% of patients who have diabetes have SIBO, and they get bloated, they get very, very gassy. And all the toxins that these bacteria make end up going to your liver and causing you fatty liver disease. So again, the symptoms of SIBO are a lot of gas, a lot of bloating, constantly passing gas, having to run to the bathroom, frequently trying to clear it. Usually there is an ineffectual urging to pass motions. Okay. SIBO usually tends to happen after a lot of antibiotic abuse. Let's say you've taken antibiotics for COVID, you've taken it for 2 weeks, 3 weeks. Again, you've had some throat infection, you've taken antibiotics. As you keep taking antibiotics, the amount of diversity in your flora becomes lesser and lesser. You have 1 or 2 species which tend to dominate in their growth. It is these species that turn into SIBO. Usually the treatment for SIBO is an allopathic drug called Rifagat or rifaximin. But the patients have to take it for life, and it doesn't do them too much of good. They still end up getting fatty liver disease. How do we treat SIBO? We have this med called as a gas relief. It's made from herbs. The principal herb is called as Kegel. We've added probiotics and digestive enzymes also to it. And we see that within a single dose, the patient's gas stops. We've even given it to patients with autism who have a lot of gas and bloating. Within a single dose, the gas and bloating stops, the child stops crying, the colic stops, and the child becomes normal. So again, even in SIBO, you could have weight gain. So these are all the infections which are leading to your weight gain. Please go through them one at a time. And if you have any of these issues, make sure you treat them before you go to your hormones. Now we come to hormones. The main hormone that is going to cause you weight gain is going to be your thyroid, low thyroid activity or hypothyroid. Another hormone that's going to cause you weight gain is cortisol or high cortisol. So let's look at hypothyroid first. Now, hypothyroid can be associated with so many diseases. For example, liver disease. If you have liver disease and you have a lot of bile salts entering inside your blood, they are going to go and stop your thyroid from forming. It's going to stop iodine from entering your thyroid, and you're going to get hypothyroid. If you're on a diet which does not contain iodine at all, or you're taking only non-iodized salt, even that's going to make you hypothyroid. But it's going to create a goiter, so that will be visible. But in most cases of hypothyroidism, it's subclinical and you don't really see a goiter. What are the other causes of hypothyroid? Third cause is again gastric inflammation. So most of the patients with hypothyroid simply get better if they stop eating milk, they stop eating wheat, and they take a little bit of N-acetylcysteine every day. That is usually enough for most people to treat their hypothyroid, especially autoimmune hypothyroid. Okay. What are the other things? PCOD. In a patient with PCOD or a patient with skin diseases like vitiligo, they also end up having hypothyroid, but these are all autoimmune in nature. If you're having PCOD and you're having weight gain, that's a completely separate topic, and I would like to create one entire webinar on just PCOD, which we should hold in the next 2 weeks. For now, just understand that your hypothyroidism can also cause you weight gain. What should be your normal TSH for you to understand that you don't have hypothyroid? Ideally, your TSH should be less than 3.5. According to the American Association for Thyroid Disease, 3.5 is your cutoff. In many Indian labs, the values up to 5.5 are considered normal, but that is erroneous. It is 3.5. Along with checking your TSH, you should also check your T3 and your T4 levels. If your T3 and your T4 are low, even if your TSH is normal, you have hypothyroid. Why is this happening? We are seeing a lot of patients after COVID coming to us with the symptom of feeling cold in their body and feeling acidity. Now, in these patients, when we check their TSH, we find that TSH is normal, but their T3 and T4 is low. These patients are having central hypothyroidism. The pituitary gland is not sending messages to the thyroid gland. The hypothalamus is not sending messages to the pituitary, because of which the thyroid is not functioning. Because the thyroid is not functioning, one of the symptoms you can get is acidity. In fact, severe acid reflux is one of the main etiology is thyroid disease. Another could also be an infection like H. pylori, but the first important cause is thyroid disease. So please remember, for all of those who have chronic acidity, remember to have your thyroid checked as the first line of testing. So again, many patients after COVID are having these problems of central hypothyroid. They also complain of little red lesions all over the skin, and then they complain of weight gain. So these patients are having those red spots on the skin. That's called as pityriasis rosea, and it happens usually due to viral infections. These patients are also getting treated with phytolacca. It doesn't mean phytolacca is a treatment for hypothyroid, but it is a treatment for central hypothyroid. If your TSH is high and it's above 3.5, 5.5, 6.5, make sure you check your antibodies to your thyroid. The two antibodies that we usually look at are anti-TPO and ATG. If your anti-TPO is raised or your ATG is raised, you have Hashimoto's, and we need to treat that autoimmune. Again, remember that the most important cause of that autoimmune is gut disorders. It's a leaky gut and inflamed gut. Just by stopping milk and wheat and taking some N-acetylcysteine, most of the patients are able to recover. Now, high cortisol. High cortisol usually happens due to stress. When you're highly stressed out all the time, your cortisol is going to get elevated. What are the symptoms of high cortisol? The symptoms of high cortisol is, firstly, your skin is going to become very, very oily. So oily skin. The next factor that's very common with cortisol is constipation. Now, this is a very peculiar kind of constipation. As your cortisol goes high, it dries your colon. This is not the constipation of a fungal infection. This is the constipation of high cortisol, in which only after the person drinks water, they are able to pass stool. So patients will tell me that when I wake up in the morning, I need to drink a large glass of water or warm water, only then I can pass stools. Because when they drink water, that dryness in the colon goes off and they're able to pass motions. The oiliness in the skin is because when your cortisol is high, it produces a lot of oil. So patients have told me that, even if they don't oil their scalp, if they don't have a bath in the morning, their scalp becomes so oily and the face becomes so oily, it's almost like they've applied oil on their head. So oily skin and constipation. Symptoms of hypothyroidism that you may not know of, as I said, acidity, severe acid reflux, coldness in the body, you start feeling cold, bone pains, because when your thyroid is not functioning, your bones don't form very well. So poor bone formation happens and you start having pains in your bones. Okay? These are about your hormones. How do you fix high cortisol? It's very simple. If you see symptoms of this, there's only one remedy that fits here. It's a homeopathic called Natmor. You just have to give Natmor 200C, like 4 drops once a day. And within a few days, you start finding that the sebum on your face is decreasing, your constipation is clearing, and you start feeling more relaxed. A small case that I can tell you of this is we had a case about 4 or 5 days ago who came with symptoms of chronic stress. They had a business loss and they had some other financial issues, because of which the person started to gain weight. His skin had become very oily and was severely constipated. Started him on Natmor just 3 days ago. 1 dose was given daily for 3 days. After 3 days, he's lost almost 1.5 kg of weight. He's no longer constipated and that oily skin has gone. So again, remember, these are the two major hormones which are important. Now we come to insulin resistance. Before I go to that, there are some chat messages. Let me look at them. Okay, so people are finding it clear. Okay. Now we go to insulin resistance. What is insulin resistance? So insulin is a hormone in our body that allows glucose uptake into our muscles. As we grow older and older, our bodies tend to get more and more inflamed. It's known as it's called as inflammo-aging. So as you grow older and older, your lymphocytes, your white blood cells, which are supposed to go and eat up all toxic bacteria and viruses, they start not functioning very well. They usually don't function very well because almost 80% of us are infected with chronic viral diseases like Epstein-Barr, CMV, which are lying dormant inside these white blood cells and they don't allow them to function very well. When you're young, even if you have Epstein-Barr and CMV in your white blood cells, you are able to form newer and newer white blood cells. So even though you have those ones which are infected and don't work, at least you have new ones forming. But as you grow older, all you have is those junk lymphocytes, those ones which don't function very well. The new ones don't form quite so nicely. So when you're faced with an infection, all you have is those lymphocytes which are going and trying to remove that infection. But because you're not very good at it, you start getting inflamed in your body. That inflammation is driven by the enzyme NOX2, which my pill Immucil targets and downregulates. So the first thing that happens before you become insulin resistant is inflammation. Okay? So for that, we give Immucil, which is my patented medicine. Now, what are the signs of this inflammation in your body? Fatigue. If you see, the number one disease that people suffer from in this day and age is fatigue. If you remember as a child, you had so much energy. A person would tell you, let's go out and play, and you'd be like, yeah, sure. But now it's almost as if you have to calculate that in the day I have only this much energy. And if I have to go out and play, well, my energy levels are going to dip, so I don't want to go and do that. So we become so conservative in terms of the amount of energy we expend during the day. And the older we get, the less and less amount of energy we want to expend. So chronic fatigue is one of the first signs and symptoms that you're becoming insulin resistant. The other signs and symptoms is if you see diabetic patients, they have these black patches on their face. That's because again of oxidation. Third is you can have skin tags forming. You start having tags of skin on your neck, those black tags start to form. Those are again a sign of insulin resistance. Then you can also start having brain fog because your brain requires glucose for it to function. So say when you were young, you could just open a medical textbook if you're a doctor and read and understand the entire chapter in one go. And now you're having to struggle trying to read the information which you had learned so many years ago with so much of ease. That brain fog is because your brain is becoming insulin resistant. You start forgetting things easily, sign of insulin resistance. Okay? Your blood doesn't flow very well. So you start having cramps in your leg muscles, cramps in the rest of your body. And your abdomen starts to increase in size. You'll start seeing that you'll have to keep going to your tailor and loosening your pant. That is a sign that you're becoming insulin resistant. How do we go about it? We give Immucil and we give this probiotic that we've made called as Akkermansia. If you Google it, you'll find so many published papers on Akkermansia. This is a gut bacteria that helps your body to become more insulin sensitive. We had a case some time back who was an alcoholic patient who had developed fatty liver disease and was very obese. When Akkermansia is given to alcoholic patients, it actually restores the sensitivity of the liver to glucose. It increases a factor called as PPR alpha in the liver, which makes sure that you start burning triglycerides and burning fat off. Within a couple of months, the patient's liver enzymes became normal and he became healthy. So just that bacteria Akkermansia is able to treat alcoholic liver disease so well. In patients who are diabetic, even in non-diabetic patients who have abdominal fat, Akkermansia helps you to burn that fat off. The signs and symptoms of insulin resistance, besides all the stuff I've mentioned, on your blood reports, you'll start seeing an elevation in triglycerides. This is a very important sign that you're becoming insulin resistant. Even if your blood sugar is normal, your HbA1c is normal, but you see that your triglycerides are elevated, understand that you're becoming insulin resistant. Another factor you can see is your LDL is going to go high and your HDL is going to start going down. You ideally need an HDL of 40, 42 is ideal. If you start finding that your HDL levels are going down, it's a serious problem. Because if your HDL is low and you become more and more insulin resistant, you'll also start having artery disease. Your arteries will start getting clogged with cholesterol, and you can start having heart disease because of it. So acromegalia is very important. It's the same drug that even Dr. Baljeet has been taking. The last one is a medication of ours known as leptin resistance. What is that? So leptin is a hormone that makes you feel full. You eat one chapati and you feel full after that. That's basically because leptin goes to your brain and says, you know what, you've had enough to eat, don't eat anymore. The most common issue that people have is they eat a lot. They feel excessively hungry. That's because leptin has now become resistant. The sensor in the brain to leptin is not working anymore. So your body starts making a lot of leptin, but the brain doesn't register it. And you start eating, eating, eating. So even though you don't need to eat, you just keep on eating. So when the leptin resistant med is given, a very interesting thing happens. First of all, in the first 1 week or so, the person starts passing lots of motions. The stomach starts to clear out because leptin actually moves the colon. When you're no longer leptin resistant, you can actually move your colon and poop all the food out. Poop all the poop out, I mean. After that, the person starts feeling hunger pangs. For 2-3 days, they feel very hungry because now leptin is actually working very well. The leptin values were very high. Okay, it was resistant, so they were high, but they were not working. After the resistance goes down in the brain, the high leptin triggers a lot of appetite. So for 2-3 days, you start eating a lot. And then as your leptin levels come down to your baseline, your appetite goes down to normal and you start losing all that abdominal fat. So that's the role of leptin resistance. The last bit is on stress. What are you going to do about stress and what are the symptoms that you're stressed? In the olden days when we were just ape men, we would only get stressed if a lion was going to attack us or something like that. Maybe 2 hits of stress a day. But now we are chronically stressed. So my patients usually ask me, what are the symptoms of stress? Because they don't even know they are stressed. So one of the signs of stress is, let's say you have a thought that keeps roaming around in your head. Okay, and every few minutes, the same thought keeps coming in your head. So for example, let's say you have a loan to pay off and you're not really sure how you're going to pay off the loan. So that thought keeps coming in your head, I need to pay off my loan. After 10 minutes, I need to pay off my loan. Or if you have some sort of issues with somebody in your family, you keep thinking about that issue recurrently. That is stress. As stress levels build up, you start having sleep disturbances. So a disturbed sleep. Now, it's not important you sleep for 6 hours, 8 hours, 4 hours, whatever. But you wake up in the morning feeling really down, feeling groggy. You feel you can't wake up in the morning properly. That's because your sleep has been disturbed. So a disturbed sleep is a sign that you're stressed. Okay. Another sign of stress is recurrent thought. The same thought keeps recurring. So what does stress do in your body? The first thing that happens is your hormone called norepinephrine increases, your sympathetic nervous system increases. As that increases, again, cortisol increases. As cortisol increases, you start gaining weight. Most people have problems with sleep. If you see all over the world, about 60% to 70% of people don't have good restful sleep in the night. Lack of sleep is one of the biggest problems that people have along with fatigue. Of course, if you're not sleeping well, you're going to wake up in the morning really, really tired. What do we do about it? As I said, if you are a type of person who fits the lycopodium category, where you have bloating and burping, okay, you get angry all of a sudden. In the house, you become very, very angry at people. You start screaming and shouting at them. But outside, you somehow have control on your body. You have sweaty palms. When you're going out to meet someone, your palms become very sweaty. You have problems in public speaking in the beginning. When you're going to speak in a public place, your mouth becomes dry all of a sudden. These are all symptoms that you have a high SNS. In these cases, lycopodium is very useful. It will treat your sweaty palms, it will make your sleep better, and will also treat your bloating and burping. If your cortisol is high, again, as I said, you will have an oily face. You will have constipation, which is only better after drinking water. If you take Natmor, you'll start feeling better. And what about your disturbed sleep? How do we fix that? So we have this medicine, which we are nicely calling LSD. It gives you the same effect as LSD. LSD is actually as a drug, it's a psychotropic drug. We are not using a psychotropic drug here. We're using the low dose form of it. And it gives you very, very restful sleep. I can tell you so many cases in which we've used it. Patients who have severe arthritic pains, worse in the night. Severe joint pains, worse in the night. When you give LSD, within 2 weeks or so, they become pain-free. These are patients with severe arthritis who are on so many drugs to treat the arthritis. Just the LSD is able to treat it. Again, stress mediated. Whenever you have any symptom which is worse in the night, understand that it's most likely stress related. So LSD is very useful for that, along with simple things like lycopodium and Natmor. What is the next little bit? You know, most people tell you, I need to control my metabolism. I wish my metabolism was higher. What really is metabolism? Metabolism is simply the ability to burn energy. You're taking glucose and you're converting it into ATP. That's all that metabolism is. As you grow older and older, your metabolism slows down. The reason why it slows down is because your cells are dying. There's so much of oxidative stress and so much of burn that has happened in your cells, because every time you make energy, there's going to be a side effect of it. When you burn petrol, there are fumes that come out. When you burn energy in your body, there are free radicals which are generated. It is these free radicals which are controlled and brought down by immune cell. So oxidative stress, as it builds up in your body, your metabolism slows down. So here again, immune cell plays a very important role in increasing your longevity. Once a person becomes postmenopausal, all of a sudden they start gaining weight. This weight gain happens because their sex hormones are not balanced. They start having hot flashes in the night. They start sweating in the night. These are all symptoms that you're postmenopausal and the hormones are unbalanced. So balancing the female sex hormones becomes again a very important part to play. In male patients, their testosterone starts to drop as they grow older. Again, because of that, they start having weight gain. The weight gain is not really central weight gain, but their arms become very flabby and the muscle mass decreases. Now, there are so many doctors who say, well, just go take some testosterone, you know, the testosterone will help you. If your testosterone is low and you just start taking testosterone, it can lead to prostate cancer. You can have so many side effects of it. So the answer is not in increasing testosterone. The answer is in simply decreasing inflammation by taking a simple thing like immune cell. So in order to improve your metabolic rate, immune cell plays a very important role. There are a few homeopathics which have been used, which have been found to be useful. So just let me get into that. Let me clear the slide out. So one of the homeopathics which is supposedly very useful is phytolacca, which I've already spoken about, but this is a tincture called phytolacca berry. This is made from the berry of the phytolacca plant. When you're using the seeds and the leaves and the roots, then it is known as phytolacca decandra, which is useful in fungal infections. But for general weight loss, phytolacca berry is supposedly very useful. When rat studies were done on phytolacca berry dosing, they found that the rat's triglyceride levels dropped, the LDL levels dropped, and they actually started to lose weight. In human patients, I found that maybe about 15 drops of it twice a day do seem to have some impact on improving metabolic rate. But again, this will only work in you if you have high triglycerides, especially if you have high triglycerides. If your triglycerides are normal, phytolacca berry has no effect on your body. Next, as I said, Natmor, especially when your cortisol levels are high. This can be taken as 200 c, 4 drops once a day. Again, if your cortisol is high. Third is lycopodium. Here, the figure of the patient basically looks like a pear. They have a thin upper body and then they look like that. So their legs swell up in size or they become big. Their arms are very thin and spidery. And as you go from a head downward position, they become more and more bigger in size. Again, this is because of the effect on the nervous system on blood flow. As the SNS increases, you have problems in getting the blood from your legs up. So you start to retain water on the lower part of your body. Here again, the symptoms are that of anger bouts, sweaty palms, and bloating and burping. The fourth medicine is known as calcarea carb, CARB. Let me write that again, calcarea carb. This is a medication that treats mainly patients who are fat, flabby. When I say flabby, that means everything jiggles, you put their arms up and they jiggle. And they're very cold inside their body. So this is a primary drug when you have hypothyroid and you're having weight gain. So a hypothyroid patient may be fat, flabby, becomes very prone to gallbladder stones, especially women above the age of 40 will become very prone to gallbladder stones, become fat and flabby, and will be cold inside the body. So if your patient is fat or you are fat, flabby, and chilly, which is cold, make sure you take calcarea carb, again 200C, 4 drops once a day, and you can lose a lot of weight. I don't know if Dr. Aziza is here with us, but she had a case where the patient was fat, flabby, and obese. And after just a week or so of calcarea carb, I think the patient lost about 6 kgs of weight. So how this medication works is it controls an inflammatory cytokine called as IL-18. When IL-18 goes very high, you can have a lot of obesity and fat inside your body. And it is that IL-18 also which leads to autoimmune disorders like hypothyroid. Okay. So these are just a few of the vast number of homeopathics that you can take for your problems. Last bit is my medications again that we use so well. Let me go back to them. So the medications that I use are leptin resistance for insulin resistance and acromencia. Both of these are also excellent in PCOD patients who have insulin resistance. Then we give patients medication of mine, as I said, LSD for sleep. Here the patients are worse in the night. All symptoms become worse in the night. Someone has put their microphone on. Okay. What else can we do from our end? We give deworming, so we deworm the patient if they're having any symptoms of worms, and we treat them for fungal infections. If you have fatty liver disease, you should, and your ultrasound shows that you have grade 1 or grade 2 fatty liver disease. What we do to treat it is we give Imucil along with another medication of ours called as Foscoliv. Foscoliv is like an emulsifier. It just softens fat and just takes it out. We have a published paper on both of them for liver disease. So Imucil and Foscoliv will treat that fatty liver out. Okay. And both of them together will also improve your metabolism, will improve your fatigue. One feature of fatty liver disease is you may not have noticed it, but if you have fatty liver disease, your skin will become very dry and you start having foul breath in the morning. So it's called as there's like a fetid odor to your breath. That also could be that you have a lot of dental decay and all. But liver disease can cause foul breath in the morning and it can make your skin dry. So you can have skin dryness. So if you're not losing weight and you have dry skin, you started notice that your mouth smells like a dead person's body in the morning. And you go to the dentist and the dentist says, well, I don't see anything wrong with your teeth. Then pretty much you may be having liver disease. So make sure you get an ultrasound done and check for fatty liver disease. Okay. So this is the most simplest webinar I could create on weight gain and weight loss. Please ask me questions so I can go about answering them. I've kept most of my time for questions. So let's go to questions. Okay, so the first question is, can we inject homeopathic substances? I'm going from down up. So can we inject homeopathy subcutaneously like mesotherapy injection in the belly? So yes, there are some papers that show that you can inject it right into the belly. So you could do that, but it's far simpler just to take it orally. Unless you have cancer and you need to take things like mistletoe at a subcutaneous level, you may not really need to take homeopathic subcutaneously. Uh, then Dr. Angi is asking, okay, that we've done. Oh, so if Dr. Aziza is here, maybe she can share a case after I finish answering. What is the dosage of Imucil and Acromencia? The dosage of Imucil is just 2 pills a day, and that of Acromencia is just like we give 10 to 20 drops twice a day. So we just put those drops in water and we drink it up. Dr. Baljit is saying that within a week he had the weight loss. That's quite true. Within a week it works. Const Constance is asking how important is taking euthyroid for hypothyroid case. How important is taking euthyroid? Euthyroid means that the person's thyroid levels are normal. If you mean taking synthyroid or taking Thyronorm or a artificial supplement for thyroid, if you do have hypothyroid, you should be on a supplement which gets your TSH normal. But even if your TSH levels are normal at times, you may still have subclinical hypothyroid. You may feel chillness in your body. You may feel fatigued. That still means that your thyroid is not well balanced and you need to treat it. So Deepa is asking any medication for thyroid. Thyroid is such a large subject that it takes me almost 3, 6, 8. It takes me about 12 hours to teach just thyroid disease and go into it. So my next course, which I'm going to do, which is going to go on for 2 years, the first 1 year of it will be on thyroid disease. It is so vast, and hence I cannot tell you within like 10 minutes of how to treat it. Question by Dr. Ramjiwadi is how fast can we see the effects? Okay, I answered that. What else is there? I'm trying to scroll up. It's kind of difficult for me to move up. Let me try to scroll upwards. No, I'm having difficulty in scrolling up. Okay, so I'm not able to scroll up. Let me try to scroll up by changing my computer screen. Okay, now I'm able to scroll up. Okay. Questions. Okay, Vinay Patel, in one of my arthritis cases, first 10 days patient feels better on sleep. After that, same as earlier. Is it so? If your patient is feeling better on sleep after taking LSD, but then starts to say that my sleep is no longer working, then means there's simply other factors which are causing the patient insomnia. So it may not just be LSD that you may need to give, but look at the other causes. As I have explained, the patient may also be insulin resistant, or they may have very high levels of TNF since they have arthritic pain that may be causing them insomnia. What is the fourth below LSD? Okay, I don't remember that. Let me see what was the fourth below LSD. Oh, that's deworming. So I deworm the patients. Okay. So I'm just going to look at all the questions which I haven't answered first and then go into other cases. Okay. Go down. Okay. Okay. The first question: what's the immune cell in the gut related with inflammation and visceral fat? Is it the mast cell or macrophage? There is no connection between the mast cell and the macrophage. The mast cell could be involved in inflammation. If you are having a fungal infection, the mast cell has to secrete interleukin-9 in order to target the fungal. So if your mast cells are not functioning properly, you could have inflammation due to a fungal infection. Macrophages are usually found, they can cause inflammation in the gut only if things like secretory IgA don't function. So if your secretory IgA levels are low, again, when your cortisol goes up, your secretory IgA will go and you will have issues. So if your IgA levels are low, the symptom will be that you can't tolerate spicy food. The moment you eat spicy food, you'll have anal burning, stomach burning, no tolerance to spice will be there. Here, there is a homeopathic called Thuja, THUJA, that helps to bring your IgA levels up. And the moment you take a few doses of Thuja, you'll be able to start eating spicy food again. Any more questions? Okay. Dr. Ramziwati is asking, can you add emetine for patient that has difficulty to lose weight? So emetine is one of my meds which helps in weight loss. So yes, you can. It helps to target CMV. It's a type of a low-grade viral infection that's there in our bodies. When CMV infections are there, you can start having a lot of weight gain. It's a side effect of CMV. I didn't speak about that, but since I'm asked, I'll tell you. You can actually get your CMV IgG checked, and if it's very high, your weight gain can simply be because of CMV. And as you start on emetine, you can actually start to lose weight. Deepa is asking, I have bad swelling on my legs in some days. Is there any cure for this? So swelling on your legs could be due to various reasons: heart disease, liver disease. You could be having varicose veins, could be having lymphatic swelling. I don't know the cause of it. Until I diagnose it, I can't help you. There's one big question. Patient 45 male, multiple issues, metabolic syndrome with insulin resistance, vascular inflammation, with left MCA stroke, depressed due to stroke, OSA, which is obstructive sleep apnea because of the weight, using CPAP and can't sleep well due to mask, suboptimal hypothyroid, methylation problems, gut is sluggish, 1 meal a day. How do you usually start the homeopathy combo? So here what I would do is, because the patient has vascular inflammation with a left-sided stroke, I would usually start on drugs like arnica. It's a homeopathy called arnica, which improves your blood flow. I would start on drugs like lycopodium, especially if the patient's right side of the body is affected. Since they're saying left-sided stroke, I think you mean left side of the brain is affected. So arnica with lycopodium would be the first lines of treatment. Then I would also add the leptin resistance with acromencia to treat their insulin resistance. And because they have obstructive sleep apnea due to weight, there are some very interesting homeopathics that could be used. So usually after stroke, these patients don't have just weight-linked obstructive sleep apnea, but they have central sleep apnea as well. There is a homeopathic called as Grindelia, Grindelia. So Grindelia treats the central sleep apnea. A few doses of it, around 200 C or so, and you give the patient 4 drops in the night. After just a few doses of it, the patient's sleep apnea will improve and they get better really fast with it. As they start losing weight, of course, the obstructive sleep apnea will also start improving. If they have suboptimal hypothyroid and they're chilly in the body and they feel cold, what I would do is I would basically check their antibodies. If the antibodies are normal and they don't have problems with autoimmune, then I would just give them supplements to help improve the thyroid activity. So supplements like selenium, zinc, omega-3 in small amounts of doses, glutathione would go a long way to improve the thyroid activity. If the gut is sluggish, I don't know what that means. You haven't explained it. 1 meal a day could basically mean that they're not having any appetite. So in these cases, again, acromencia and the leptin would work very well. So I have pigmentation on my face and my neck and my hands. Any treatment? So if you have pigmentation on your face, neck and hands, again, we need to know what type of pigmentation it is. It could be due to fungal infection. It could be due to post-menopausal pigmentation. Maybe Dr. Aziza can share her own case for the hyperpigmentation. Are you there, Dr. Aziza? Would you like to unmute yourself and talk about a few of your cases?
Dr. Aziza, are you there? Yeah, I'm here, but my voice is very bad since I'm having bad cough, doctor. I'm using, for my pigmentation is very bad after I had my menopause. I start using Sepia, Phytolacca, and also I'm start using follicolinum and
Arnica.
progesterone at night, and arnica also. Then for I think almost 12 months, then my pigmentations I think has gone more than 80%.
Right. So what we do is we gave Dr. Aziza arnica, which is a medication that helps to decrease inflammation in the body. We gave Sepia, which is a medication that helps to balance the levels of estrogen and progesterone in your body. That helps to treat post-menopausal pigmentation. We gave Phytolacca, which is again a medication that helps to block the enzyme tyrosinase that leads to the formation of melanin. Also treats out fungal infections in the body. And this is the basis of how we treated the hyperpigmentation. Your skin can actually look just as healthy as it was when you were 30 and 40. You don't need to get hyperpigmented. You don't need to apply fairness creams. You actually need to treat your body from inside out.
Thank you, Dr. Tariq, for that.
Thanks, Dr. Aziza.
I
You can
always look
also
much
share
more
the
younger than my other
calcarea-
friends.
Yeah, you can also share that calcarea carb case that you did. You want to talk
Yeah,
about?
the Calcutta Cup case, the patient was fat, flabby, and chilly. You know, when they come to me, they were complaining about their weight gain. You know, so I just gave a drops of Calcarea Cup for almost, I think, 2 weeks. But when they come back, they have reduced so much weight. I think about 6 kg within that 2 weeks.
Yeah, exactly. So that's
Yeah.
again because there was high amount of IL-18 and they were like fat, flabby. They were filled with fluid, right? And
Yeah.
they were obese and chilly. So that's cool.
Thanks, Doctor.
Thanks a lot, Dr. Aziza. So if you are not a doctor in this group and you haven't attended any of my webinars, some of the words that I'm saying like acromens and all may sound like alien words, but you should get, I mean, you'll get used to it after a point of time. Let's see, are there any other questions? Deepa Singh, I'm on allopathy medication for thyroid. Is there any possibility to cure this and keep TSH levels naturally in our body? So yes, it doesn't matter whether you're hypothyroid since 10 years or 20 years, if there is still some thyroid activity left. So for example, let's say Deepa, you have Hashimoto's, in which the body's immune system has attacked your thyroid. Now, if there is some amount of thyroid still left, you know, we could help you to keep your thyroid active. In fact, since we were just speaking to Dr. Aziza, even she had Hashimoto's hypothyroid, in which the anti-TPO was sky high. It's now almost normal. It's near normal. I think within a few more months, it'll become completely clear. Even after so many years of hypothyroidism, it's almost cured now. So there are many such cases that we have cured of. Dr. Ishwari is asking diet of girls just after menopause to avoid weight gain and later PCOD. See, so girls who are in their menopause are going to eat because it is a fat that is present in the body, which leads to the formation of the first menses. If you're fat deprived, you're not going to have your first period. So fat is required to become the precursor for all the sex hormones. But PCOD, what we have found is initiated by two things. One is chronic stress, where when we use lycopodium in patients in the initial phase of PCOD, we found remarkable effects on them. In fact, there are many published papers that show even before the first cyst forms, the sympathetic nervous system activity has to go above a certain threshold for the cyst to form. So even 6 months before a cyst forms, the SNS activity has to go very, very high for that to happen. So things like lycopodium work very well. The next part is, of course, because they're eating a lot of carbs in their diet, they do tend to become insulin resistant. If they become insulin resistant, you start seeing acanthosis on the skin. In the armpit areas, they start having pigmentation. So if you as a parent or as a doctor start noticing that your girl is having pigmentation in the armpit, or they're having a lot of acne on their face, which is all of a sudden started to develop, that means they're becoming insulin resistant. There's a simple homeopathic that can be used in order to treat that acanthosis. Along with my leptin med and acromencia, there's a homeopathic made from saffron. You can just Google it. And when you take that saffron in orally, you'll find within a few days that pigmentation goes away. So one patient of mine who was not getting pregnant with PCOD, without giving her any other treatment for PCOD, she was able to get pregnant, stay pregnant, and she didn't require any insulin, any metformin during the entire treatment. We just treated her with the saffron extract. The moment we would notice that the skin pigmentation is increasing, we would increase the dose of the saffron extract and that acanthosis would go away. So the saffron is beautiful to treat this.
Dr. Tariq, I want to add in some things. The girls that I give Calcup and reduced weight is now pregnant for about 13 weeks. It's already 13 weeks where she got married for 3 years already.
Wow. So
Yeah,
that happened within just a few weeks of the Calcup.
Yeah, she was actually about to plan to go for the IUI. She came to me because of a long COVID. She came to me for long COVID and she's having this problem. So when I'm asking how many kids do they have, they say they don't have a kids yet because maybe the wife is on the bigger side. So I try to give that, teach a bit of exercise and restrict on the sugar intakes. And not long after that, I think within the same months, they got pregnant after they lost about 6 kg. They got pregnant and I'm still continue the Anika and sulfur in order to stop the clottings from the small arteries, you know, because the hospital is about to start on aspirin. So I stopped the aspirin without the hospital know about it, and I still continue the Anika and sulfur daily dose, 30C daily dose, and the pregnancy continue. They still follow up at the hospital for their precious pregnancy, and now they can see the heartbeats.
Oh, awesome. So the reason why Dr. Aziza is giving the homeopathic sulfur and arnica, for those who don't know, is it stops clotting in the vessels. So usually when a patient is having PCOD and they get pregnant, their D dimers go up, then they start having small clots, which decreases the placental blood flow. Aspirin is supposed to help in this, but in many patients, even after they take aspirin, they don't get any better. Same thing for my patient also. She was on aspirin and she didn't feel very good taking the aspirin. So we actually stopped aspirin and we did the same thing that Dr. Aziza did. We gave her arnica and we gave her sulfur, and she was able to maintain proper placental blood flow. Dr. Angi is asking, can we combine this homeopathic with probiotics? So you see the thing with probiotics is probiotics can sometimes turn inflammatory. I'll give you an example of a Crohn's case. In a Crohn's case, if you give probiotics to the patient, they get even worse because the intestinal epithelium is already inflamed. So it doesn't know how to separate the difference between a good bacteria and a bad bacteria and gets inflamed. So we found a way around this. Now, when we give probiotics to a patient and they get worse after the probiotic, what we give them is we have this low dose form of colostrum that we've made. When we give this colostrum, basically colostrum teaches your body how to differentiate between good bacteria and bad bacteria. If colostrum levels are low, you're not able to differentiate that and your body starts reacting badly to probiotics also. So if any patient starts reacting badly to a probiotic, all we do is we give them colostrum for a few days. After the first day, they start having like a sensation of vomiting and they even vomit like once or twice. After that, their stomach pains, cramps in the stomach, bloating, gas, everything clears off. So at times, instead of just giving probiotics, I use probiotic to test if the gut is able to differentiate good or bad. If it cannot differentiate, they're going to feel worse after probiotics, and colostrum is very useful. So arthritis patient pain, inflammation aggravated by curd and citrus food. Yeah. So if your arthritis patient is aggravated by curd, it's because they may have problems with yeast. If they also have aggravation due to citrus food, the only remedy is Crotalus horridus. Let me type that in. If you give Crotalus horridus to the patient's arthritis pain will go away. If your patient is sensitive to curd, especially outside curd, which is very rich in yeast, then the drug would be phytolacca, but otherwise it could just be Crotalus. I think I've sent this message to Amanda. Let me put for everyone. Okay, let me type it again, Crotalus horridus. Okay, that's the name of the drug. My opinion on the ketogenic diet is that it's very difficult to do. It's very difficult because you start feeling hungry and you become actually nutritionally deficient during it. So while Dr. Baljit, rightly said that it's good for a few weeks of month at the max, but if you continue to do it, you could possibly die. So while ketogenic is good, but I would not recommend it for a very long period of time at all. Any other questions? Does anybody have? You want to share your own case, Dr. Shambal, of how the meds have impacted your stomach size?
Sure, I love to do that. Actually, last year I had got COVID and I happened to take Immucil at that time. And I was not Dr. Tariq's student. So I just took it and post delivery, my stomach was like really big, like a barrel. And every time I would squat, I would feel breathless because the abdomen would push up, And post-COVID, I was like, oh, wow, I'm able to squat. Thank God COVID came here. But actually, it was the Immusil, and I just realized it when I started studying with Dr. Tariq. Also, he had started me on lycopodium for my fungal infection. But because of lycopodium, lot of burping and acidity and acid reflux stopped. Like I would have typical evening symptoms, after evening tea, 5 o'clock, 6 o'clock, I would have headaches, I would have regurgitation. So all that drastically reduced with lycopodium. So overall, I would feel lighter. Others earlier, even if I would wear any clothes, I would feel like it's tight on my abdomen, I couldn't tolerate it. But now it feels light. I'm fitting into my old clothes also. And yes, I have some more inches to lose. So it's on its way already. I've lost, I think, 3 or 4 inches when I started. So yeah, that's about it. Thank you.
Nice, good to know.
What is your weight now, Dr. Shama?
Sorry?
What is your weight now? You look so pretty.
I've always been underweight, but this is all about the gut health also, right? So I am that typical, like a, what do you say, like a cherry on a stick, just big in the middle with a big abdomen. Otherwise, my weight is 47.
Yeah, as I said, the biggest problem that people have is the weight, the weight in the center. It's the central weight which is the biggest problem. That becomes the most difficult thing to do. Vinay Patel is asking me male infertility with low sperm count. Now that's a complex question to ask because you could be having anti-sperm antibodies. The sperm count could be low because you're lacking coenzyme Q. There may be an obstruction there. So that's a complicated question to ask me right now. My course has already started. You can join at any time. Actually, it's a 2-year course. All my videos are already uploaded and we keep having new videos every 2 weeks. If you'd like to join, you can just WhatsApp me or mail me and we can share the course details with you. Lycopodium, the dose, see the potency, you can just use 200C or you can just call up your batchmate Shamal and she can guide you as to how to take it. Dr. Merkel is asking me how much and what's my number. I'm messaging you my WhatsApp number for everybody, 9869727740. If you're from outside India, you just need to put +91 before this number and you can just WhatsApp me. Or you can even contact Dr. Sharma right away. If you're from Indonesia, we can send the meds to you. We already have doctors in Indonesia who are using the meds, so you can just contact us and we can do the needful. Any other question? Is there anybody else who'd like to share? There's so many doctors here who are in my course. Would you guys like to share any of your cases of weight loss or diabetes? If not diabetes, even the skin cases. Oh, you can share those skin cases now, Dr. Sharma.
Yes, I have done a couple of skin cases. Most of them had fine line wrinkles, including me. So all we have done is taken collagen, and you see even those fine pores, close after taking the pills. Most of the patients that I've treated have acne. They have these marks which stay after the acne, and most of them have constipation. Now, constipation, like I learned from Dr. Tariq, is not, not inability to poop in 3 days. It means even if you spend too much time in the washroom, if you are not, your bowel is not getting cleared at one go. So most of them had constipation in some or the other form. So they started passing stools very easily, plus their skin cleared. Like I have had a model who's had pimples on her body as well, on the hands and back. Even those have started to reduce. So it's a very good result, and I see results in 15 days. That's like really fast.
Yeah, so once again in weight as well, what happens is the patients usually come to me when they have a lot of stretch marks on their skin. So they come with stretch marks which are there and they say that my skin looks very flabby. So they may not really come for weight loss, but that sort of flabbiness to the skin, all the stretch marks, skin is not smooth anymore. It's become like rough on touch. So for these cases, what we did is we developed these collagen pills. It's not just collagen that we're adding to it. We're adding enzymes like hyaluronidase or anti-hyaluronidase, anti-elastase, anti-collagenase, which stop collagen breaking down in your body. It stops hyaluronic acid breaking down in your body and stops, your skin from basically breaking down. And when patients take this, they see effects within just 15 days with their fine lines and the wrinkles actually clearing out. So it's a great anti-aging drug. When this is taken, it actually works on the liver and helps you in a thing known as phase 2 detox. It helps you to detoxify toxins in your body through a process known as phase 2 detox. So as your skin gets detoxified, it becomes more fairer, becomes more clear, and it also has an impact on the skin elasticity, and that's why these stretch marks and all start to go down. So this is one other part of obesity which is not easily tackled, and people don't know anything much about it. Okay, so let's conclude. If you have weight gain issues, again, the conclusion would be that you look at your stress hormones, you look at your gut health, and then you look at your hormones like thyroid, cortisol, and insulin. So this is the entire gamut of it. If you feel that your weight is stuck at any point, make sure that you look at these factors and then go about it. Calorie restriction is a beautiful way. Of course, if you don't eat, you're going to lose weight. But it's a very difficult thing to do of not eating, because you're going to become irritable, angry, you're going to have fights with people in your house, which is not what you want in order to lose weight. Okay. Dr. Julie saying that she had a 42-year-old lady with primary infidelity who had failed 4 IVF. She also had recurrent fungal infections. Her husband is a diabetic too. We just gave her the antifungal combo for 2 weeks and 6 weeks for Immucil for both husband and wife, and she got pregnant naturally. Really nice. Good to hear that, Dr. Julie. So thanks a lot for all you people who have joined in and stayed up for all this time and spent your precious time with me. Again, thank you so much for that. I hope to see you again after a few weeks, and let's hope to do a course in PCOD where we can focus on one particular disease and help you guys learn more about it. Almost 1 in 10 women in India has PCOD. It's such a high rate and it's increasing all over the world. So let's hope I can throw some light on that as well. So thank you all again for joining me. See you next time. Bye-bye.
Thank you, Dr. Tariq. And Dr. Tariq's intention is to let everybody learn as much knowledge as needed as possible. And he has a big heart, and his intention is to do no harm and let everybody know what we can do easily and make the treatment effectively. So let's just give a big round of applause to Dr. Tariq.
Thanks, Amanda. Thank you so much.
Should there be any inquiries, please call Dr. Shamal. Okay, in India and overseas, you can call Amanda's. And also, if you have any difficult things, we will always relate to Dr. Tariq. His brain is very, very vast. Inside his brain is a lot of knowledge. So let's dig out all of his knowledge and make fullest use of it. Thank you very much for everybody to attend today's classes. Thank you all. Thank you, Dr. Tariq.
Bye, everybody. Bye.
Bye.